Hey guys, welcome back to Urology 101. I'm James Farrell, and Urology 101 is my video blog. It's on common topics in urology, and they are often taboo or embarrassing just because we use sex organs a lot. Now, my content's focused on getting you some useful medical knowledge that you can apply. And this video and all my other videos you can find on my website, which is urology101.com, and the first part of that is spelled Y-O-U-R. Maybe you're watching this on YouTube. I post them all there as well. The channel is Urology 101, and I post most days on Instagram. Great content, shorter format, wider variation. Definitely check that out as well. Same name, Urology 101. So with that, let's get into today's topic. Now, a handful of weeks ago, I had spent a video talking about preventing stone disease. And a handful of you got back to me like, hey man, that sounds great and all, I love it, but I got stones, so what do I do about that? Fair point, so let's get into that. When we talk about stones and dealing with them from a surgery standpoint or passing them, there are a couple things that are in play here. And one of them is that, yeah, size matters. In this case, it does. And so we're going to get into why the stone size matters. Also matters placement, where it is, what happens. And in that sense, it's actually kind of like algebra. It's an order of operations thing. You get to add inside parentheses and you multiply here, but you got to do that first and all that stuff. And that actually applies here. So there are a few reasons why maybe if you've gone through with your doctor or urologist, why it's kind of weird in terms of thinking, well, what are we doing with this and why do you say that, or she wanted to do this first. There are reasons, and I hope that they're well explained to you. And I hope that this reinforces all that. So let's get into it. When we talk about stones, things that happen, we can observe them, we can wait for you to pass stones, we can help you pass stones, and we can go do surgery on them. So when we talk about, let's start with how you kind of present and find out you have stones, because most people do it by going to the ER in miserable writhing pain, and that's sort of what we talk about with the kidney stone pain and what's called renal colic and passing a stone. All of that really acute sudden pain starts here, travels around or travels back this way. Maybe it's associated with some nausea, vomiting. You get to the ER, get a bunch of medications, usually a CT scan. Somebody tells you you got a stone. Congratulations. And you come see us as an outpatient. Now, if that stone is in the ureter, and the ureter is the muscular tube between the kidney and the bladder. So let's look at this on a model, or at least a page. Kidney's right here. All right, this area is where all the blood filters, and then whatever the kidney wants to get rid of, it shoots into this area right here, and this is where urine collects. It travels down this tube called the ureter and goes to the bladder. When you feel that miserable pain from a stone, what you're actually feeling is a stone traveling usually from here down to here, okay? And a stone that is less than 5 millimeters is fairly likely to pass. And that works out to be kind of the dividing line. Like less than 5 millimeters, most people can pass that. More than 5 millimeters, most people cannot. And a lot of times we'll give you medications to help with that. That's called medical expulsive therapy. Now the medicines are designed at reducing inflammation. We do that with Motrin. At widening the diameter of the tube, we do that with something called Flomax or Uroxetrol. And then controlling your pain, we do that with Percocet or Norco or some type of oral narcotic. Now, the anti-inflammatory and the medicine that kind of relaxes the ureter, well, those help dilate the ureter just a little bit because it's a tube that's like 2 to 4 millimeters in width. So getting it to dilate a little bit allows that stone to trickle down and maybe you pass it out, and that saves you a surgery, and everybody's happy when that happens. So if that happens, great. We usually give people 4 to 6 weeks, but after that, if the stone is still there and you haven't passed it, even if you don't have pain, we do want to go get it, or we want to prove that it's been removed, because leaving it there for a long time can actually cause your kidney some real long-term damage. So we want to know that it's gone. So if you're sitting here watching this and you're in that spot where you haven't seen that you passed it, you haven't seen a bunch of blood clots come out, and you still sort of feel like you got a stone, but the pain's not that bad, please go see a urologist, because you do need to make sure whether it's gone, just to make sure that your kidney health is good long-term. Okay, so moving on. Let's say that the stone doesn't go anywhere. So let's say that you've got a stone that's like sitting right down here by the bladder, okay? So what we do in that case is we actually go up and get it. So you are asleep. This is a surgery, but there are no incisions. We go through your urethra, into your bladder, up into the ureter. I know this probably sounds terrible, but you're asleep and it really isn't. It's tolerated really well. It's not that bad. All right, so, but you're asleep and we go up here, and if it's small enough, we just pull it right out. And if it's a little too big, we break it up with a little laser. It's a small laser, delivers energy to whatever it's touching, very safe. Break it up into pieces, pull those pieces out, you're good to go. Same deal, let's say it's not there, okay? Well, let's say that it's up here. All right, so same deal. We still go up here with the flexible telescope, look inside the ureter, break it up into little pieces, pull it on out. At the end of that, we will leave something called a ureteral stent, and the stent, stay there. The stent looks like this, and it will sit up here, kind of like that, and sit the length of the ureter. Now let's talk about this guy for a second. This little guy causes more people concern than probably the surgery itself. It is a hollow plastic tube like a straw. It's long, right? I mean, it's got a curl on each end, and if I stretch this thing out, it is the length of my forearm. So when people are pulling this out, it's sort of like that magic trick with all those sashes attached, and they just keep pulling and pulling. And so patients will come back after they've removed this. We'll talk about that in a second. After they've removed this, going, "Doc, that thing was forever. That was so long. What did you do to me?" So here's the deal. The stent is important for two reasons. One, the reason you have pain when you come in the ER and it's really bad like that and the stone's in the ureter is not the stone itself. It took you months to make the stone usually. It's the actual distension from behind the stone. The urine is stuck, it pushes out, it pushes back. And if we operate, we remove a stone, but we're moving back and forth inside that narrow tube. That narrow muscular tube is going to slam shut, and you are going to have all of the sensations that brought you in with the miserable pain in the first place. Because again, the pain is from the obstructed flow of urine. It's not from the stone itself in this case. So one reason the stent's there is to reduce your pain after the surgery to keep the ureter open. The other thing is that a stone rolling down a ureter is sort of like sending a boulder through a flower field. It destroys everything in its path. Also, just going up and down the ureter a bunch, just that movement up and down, causes a bunch of inflammation just from the telescope. And so when that ureter is healing, what we want it to do is heal nice and open and healthy. And if we don't leave a stent, it has a better chance of healing tighter and narrow, and that's called a stricture. So the stent does that too, helps it heal well, reduces your pain. Now, that comes at a small cost. Because it's a plastic tube and this curl sits in your bladder, this curl sits up in your ureter, and, kidney, and as they move around, it tickles the inside of the muscular ureter and the muscular bladder, and it's going to cause you to feel like you have to urinate all the time. We have medications for that. It's kind of annoying, and people call with stent symptoms a lot, and I get that. But it is there for a good reason. We're not just sadists, I promise you that. Now, the other thing that we do is a lot of times we'll leave a string attached so that you can actually pull it out. And as you watch this, you just slide it right out like that, and the thing pops out. Kind of a weird thing to do. Maybe it's best to tell after a few drinks with some of your friends, but it comes out pretty well. If you don't feel comfortable, we can pull it at the office. Some urologists won't leave a string for a number of reasons. And what they'll end up doing is having you have a telescope or do a flexible cystoscopy to look in the urethra, grab the stent, pull it out a handful of days after surgery. The stent usually stays in like 3, 5, 6 days, stuff like that. Okay? And that's again just for health. Now, what happens if you don't just have stones in your ureter? What happens if the CT scan shows no stones in the ureter, but you got a couple stones up in your kidney? All right, so let's say that you've got a stone sitting right here, and maybe you've got one, up here, or you just have one in one of those spots. So, stones up in the kidney. 20% of stones over the course of a year that are up in the kidney will travel into the ureter and provide you those symptoms, or you'll pass a stone. 20% of stones will get larger over the course of the year, but they don't tend to dissolve very well, and they don't tend to magically go away. So if they're not causing you symptoms, you have time to wait. We can put off doing anything for a while, see if it changes. We can work on the preventive side on that other video and talk about some of the stuff that you can do to try and reduce your ability for the stone to get bigger. And maybe you'll get lucky. Maybe it's something that we actually can dissolve, and that saves you a surgery, which is always great. So the other options are to go and deal with them. We can do ureteroscopy to go get them, all right? And if there are multiple stones in a lot, sometimes that's the best answer. The other thing is if you have one stone in a place, you can do something called shockwave lithotripsy, or just shockwave, or extracorporeal shockwave, or S-wall or ESWAL. Again, 6 names for one thing. So confusing, but I wanted to give you all those names. They all mean the same thing. And what they mean is that you are asleep, and we focus ultrasound shock waves on the stone from the outside of your body. And so it's this little thing where it kind of sounds like this, and it's hitting any end of I should just go through the rest of this video. No, I shouldn't go through the video that way. But that's what it sounds like. It's this constant like, and it does that for like 30 minutes. Now, over the course of that, it breaks this up into tiny pieces, hopefully gravel or sand, something like that, that you urinate out. But it's not perfect. Sometimes it breaks it into larger pieces, and sometimes you have to pass some of those pieces, and it's really uncomfortable. The other problem, and just think about this from a logic standpoint and positioning. Okay, so if we call this the lower pole, and this is the mid pole here, and this is the upper pole, and this is the head of your body up here, and your pelvis is down here, obviously a stone up here that we break up is going to travel better, right? That stone is going to move down the ureter by gravity, and that's great. Those pieces will probably leave. But this one right here, it has to go up to go down. And so some of these angles here, sometimes this can be really deep in the kidney, and there's no way that shocking the stone and breaking it is ever going to have it go upward. So sometimes we can shock stones, but they won't go anywhere. And that hasn't really done you any service. We haven't provided you a benefit. So shockwave is really good as a first-time surgery in only about 50 to 60% of patients, and it really does depend on the size of the stone and where it is. And so if it's up high, it might be a good option, but maybe it's not a good option in other cases. So that's why that conversation comes into play. And you should ask your urologist about that, because that stuff matters. It may change things. So in this type of a case, it might be better to do a ureteroscopy, to go in, find it, break it up into little pieces, and pull out the pieces. We can do that. And about 90 to 95% of the time when the stone's there or anywhere in the kidney, we can break it up and remove it. Sometimes some pieces get left behind because it is a small space to work. It does cause some blood. It does get hard to see. And so you don't always get all the little pieces. So sometimes with really big stones, like 2 centimeter, 3 centimeter stones, if you're doing ureteroscopy, your surgeon will talk with you about how we may have to do it twice. And that's just because it's hard to get it all at once. And if we did shockwave, sometimes those stones would get stuck and all the pieces would get stuck in here, and that causes you a new problem too. So there are options, and the size and the location matters is really my point there. Sometimes though, let's say that the CT scan shows that you've got a calcification or a stone, but let's say it's in the meat of the kidney here, because a lot of stones form where all the blood passes. So if it's actually stuck in a piece of in the meat of the kidney here, we can't see that. So we may go up here and we may say, you know, I don't know if I'm going to be able to get all these stones because they might still be stuck in the actual meat of the kidney, and that happens sometimes. So if they say, you know, I got everything I could see, and then 2 weeks later you get a CT scan and there's still stones up there, sometimes that's actually why. We just couldn't cut into the kidney and just blindly start looking for stuff that wouldn't do your kidney any good. And that's why that situation happens sometimes. All right. In general, these surgeries are really pretty well tolerated. There are not a lot of long-term problems that develop. If you've had a bunch of shock waves from outside your body, diabetes and high blood pressure are things that have been associated with that. But a lot of people who make stones have diabetes and high blood pressure, so there's what's called a confounding variable there. Ureteroscopy long-term, sometimes you can get some narrowing of the ureter if you have to go through 7 or 8 to 10 of these. So it is really important to prevent stones, which is why we talked about that in one of the other videos. Overall, though, as a one-time thing, these things are pretty well tolerated. You go home that day, rarely do you get an infection because sometimes stones can have bacteria in them, but about once a year I'll end up admitting somebody for a fever after these cases simply because the stones have bacteria. You will certainly get an antibiotic in your surgery. You'll check urine cultures beforehand, but sometimes people can still get a little sick. Antibiotics cure that and you're all good. Recovery, 3 to 5 days, depending on the surgery. You're usually up, back, moving around, doing what you want pretty quickly. As soon as the stent's out, that type of symptom tends to go away over a day or two, and you get much better that way too. So you also can have some blood in your urine for a few weeks, and that's pretty normal. Drink a lot of water, stay well hydrated, and that'll reduce some of those clots and some of what it looks like and some of the sand passing and the blood and stuff. All right, long video. I hope you stuck with that. I hope all that stuff makes sense. Please send me your questions. Take care of yourselves and your families. You guys have a great day, and we'll talk soon. See you guys.